welcome to another episode of Cancer Convos with Grace B. Your host is Grace B, coming all the way from New York City, the city that never sleeps. Welcome to another episode. We're now in season 8, episode 2, and it gives us great pleasure to have a fantastic lady who's going to be talking about something that is very critical to us cancer patients, and that is patient navigation. I will be welcoming Tricia Truskowski from the Turnkey Oncology, and she will be here to give us a breakdown of what patient navigation is all about and how she has been able to bridge the gap between patient navigation and cancer care. So, without much ado, let me welcome you to Tricia Strusowski. Thank you so much for coming on. Hello, dear Tricia. So wonderful to see you. How are you today?
I'm great. It's so good to see you too, Grace.
Thank you so much for coming on and for, staying on this side of the conversation to do with patient navigation. Could you give us a brief introduction of yourself?
Absolutely. I've been in navigation my entire career, so about 42 years. I just fell in love with it. I started as a brand new nurse on a hematology unit, which is a lot of the blood cancers, the leukemia, lymphoma type patients, multiple myeloma, and never left. I mean, I was in different roles throughout that. I was in bone
Mhm.
marrow transplant, and then I was actually a nurse manager. And then I got into case management with oncology, did some home care and then was clinical director at the Helen F. Graham Cancer Center, where I oversaw 8 different departments and
Wow.
just love everything about oncology, love program development, love navigation. We started our program at the Helen F. Graham in the late 90s. And it was, really helping patients across the entire continuum, them and their caregivers. And then I got involved on a national level through American Cancer Society, Oncology Nursing Society, Academy of Oncology Nurse and Patient Navigators, Biden Cancer Initiative, just to name a few. And I love helping others with their programs at this point too.
Oh, this is wonderful. So you're a rock star in this business, right?
No, no,
You
Grace, no.
are, you are a rock star, because I read up about you and even since I'm also, affiliated with the American Cancer Society, you have been on our radar. You've been doing fabulous things. Um, a year ago, I was, one of the speakers, or should I say the keynote speaker about patient navigation. And it's so wonderful to have you as the expert come and give your take on this because I was, talking from the patient point of view. So wonderful. Now, given your expertise and everything, why do you think a patient actually needs a navigator? And what is it that you see is lacking in the health system as regards this?
Yeah. So, one of the scariest words anybody's going to want to hear is cancer. You have cancer. That word is probably one of the scariest words in our dictionary. And patients and their caregivers, it's frightening. So then let's also put on top of it all of the people, right? Surgeons, medical oncologists, radiation oncologists, interventional radiology, clinical trials, social workers, dietitians, genetic counseling, and then all of the different terminology, right?
Mhm.
Around chemotherapy, immunotherapy, targeted therapy, different types of radiation. It's a lot of new words, right? It's a lot of new treatments, and it's quite an introduction to cancer because everything is new.
Yeah.
So why do they need navigators? So navigators, their role is to get that referral as soon as possible, even maybe before you're diagnosed with cancer, if you have what we call a suspicious finding.
Hmm.
But really, once that cancer is confirmed, your navigator is going to contact you. It's very much individualized assistance, which patients and their families deserve. And they're going to say, okay, tell me what you're concerned about right now. What keeps you up at night? What are some of your barriers around like your medical treatment or your psychosocial, right?
Hmm.
What concerns do you have around finances or
Hmm.
legal issues or copays or transportation or childcare, elder care? It can go on and on. So actually, navigators provide a very individualized evaluation early in what we call the continuum, as soon as they meet that. that patient so they can really identify what those concerns are and
Mhm.
provide those interventions. So I think the one-on-one assistance throughout the continuum, so it's not a one and done either,
Mhm.
Grace.
Mhm.
These patients are actually, they walk, these navigators walk with patients across the entire journey, which really means a lot because that trust is really developed.
Yes.
That navigator can pick up on very small things like, something's not right today. What's going on? I can sense you have some concern. So,
Mhm.
and patients appreciate that. So
Mhm.
it's really important because it's much more complicated than it ever was, cancer
Mhm.
care. There's more treatments. There's genetics. There's genetics even before you start treatment. What does all this mean? There's clinical trials. What is a clinical trial? People are still scared of clinical trials.
Yes.
So that's kind of why navigators are really important for the patient care that they receive.
Absolutely. And to go back to what you said, is it something that you have to ask for? Or, I mean, a resource, having a patient navigation resource as a patient? Because when I was going through my own issues, when I was diagnosed, having a patient navigator walk with me was never brought up. I sought for one. And that person, I didn't even have to pay out of pocket. She was a retired friend who went out of her way to walk with me every step of the way. And when I ask questions, they say, sometimes the insurance doesn't cover this, for a lot of patients, not just a few, a lot. Why do you think this is so?
So So you shouldn't have to ask for a navigator. If a program has a navigator, for example, our program, we used to get the positive pathology report. So that was a report that's saying this patient has a confirmed diagnosis. We
Okay.
would always want to make sure the patient's aware of their diagnosis before we would ever call the patient. We want to make sure that doctor had that conversation.
Hmm.
So that's a little bit more automated. Some
Hmm.
programs may wait for referrals from different doctors,
Okay.
whether it be a surgeon, medical oncologist, or radiation oncologist.
Hmm.
Some programs are nonprofits. I work with a program up in New York, and we work with specific doctors, and they will actually make the referral to our program. So there's different ways. I also say the best marketing is patient to patient. A patient might be sitting in chemotherapy or radiation and say, "Oh my gosh, who's your navigator?" And they're like, what do you mean, my navigator?
Yes.
Right? They're like, oh my gosh, you don't have a you need to have a navigator. Because I hate to say it, even the best fine-tuned programs that
True.
we may miss a patient here and there, but they should ask about it. And guess what? Even if your cancer program doesn't have it, nonprofit programs across the country have them, whether it be cancer support community. I work at Share Cancer Support. It's for women cancers up in, New York, but we take referrals from across the country.
Hmm.
Komen, Breast Cancer Coalition. I mean, there's many, many programs, American Cancer Society. So
Hmm.
you should be able to find a navigator. But
Okay.
sometimes you have to reach out for yourself, but that's
Yes,
okay.
yes. And, my diagnosis was like 10 years ago, so things have gotten much, much better ever since then. There's more awareness and everything. That's good to know. And at least my audience will be able to, use your nuggets to, advocate for themselves and empower others as well. So, as an expert who has seen, so much, from diagnosis to survivorship. From your own point of view, what do you think has been broken in the system? And what do you think, over the period of time that you have worked, what do you think is broken in the system? And what do you think has actually improved?
Yeah. So what has been broken? And this is directly from patients, because I think, if
Yes.
you have a robust program, you're going to also want to meet with your patients and caregivers pretty frequently. You could have an advisory group. And so a lot of times they'd say, geez, I don't feel like I was listened to. I don't think they were listening to, my personal life goals or my treatment goals. We all have different goals.
Mhm.
It doesn't mean the same thing for everybody. So I think where we could still do a better job in healthcare is to really listen. And this is actually from a national report too, out of the Institute of Medicine. It was the number one concern of patients. Please listen to me. Where have we gotten better is patient really has become patient and family centered. It can still go a lot further, but guess what? As we start to ask the patient or have them be a part of those discussions,
Mhm.
tell me what the doctor told you. Do you understand what the doctor told you? What didn't you understand? Because sometimes patients are still afraid to ask, like, I don't understand what that meant at all. And that's why we encourage the family to stay involved. Caregivers, bring somebody with you to these appointments. Take notes. Sometimes they'll even let you tape the conversations just because there's a lot of new terminology. And so a lot of times you don't have the opportunity to ask the questions during your visit. So I think, communication is important. Could we do it better?
Mhm.
Absolutely. But I think that's again the beauty of navigation is that, a lot of times I might be calling a patient and say, hey, what did the doctor tell you yesterday? Did you
Mhm.
understand what he told you? And like, well, not really. I didn't understand, what you were talking about cycles of chemotherapy. I had no clue what a cycle was, or I had no clue
Yeah.
what a negative result or a positive result. I didn't, we're not talking the right level with some of our patients sometimes. So we have to learn from that as well, too.
Oh, that is brilliantly explained because now it actually shows us that the patient needs to have a voice in the conversations. It's no more patriarchal like when we were growing
Mhm.
up. Whatever the doctor said was, good to go. Um, Now we have a shared decision making in it, and that makes it fabulous. Honestly, that's
Absolutely.
fantastic. So, something that, we hear over a period of time is palliative care. And this frightens a lot of patients. Sometimes it shows that maybe there's no hope anymore or something, as regards their health trajectory or healing and recovery. Could you please explain why this frightens one and how to, from your experience, when is the best time to bring up this conversation about palliative care or no
Yeah.
palliative care?
I love this question. I love this question, Grace, because the reason is patients confuse palliative care with end of life care. It's not the same. Palliative care, which should be introduced earlier in the journey, is
Mhm.
really all about quality of life, symptom management. Wouldn't we all want to have the best management of our symptoms as we go through cancer care? Around, neuropathy, nausea, vomiting, diarrhea, all of these different concerns, hair, skin, everything that we go through, with the different modalities, feeling like you have the flu. Well, we don't
Mhm.
have to actually experience that. Our patients don't have to experience that. We can help them manage that, whether it be through, medications or whether it be through mind, body, spirit, visualization, meditation, very important. Our brains are very, very powerful and can help us
Yeah.
tremendously. So, what we tell our navigators is some of these conversations need to
Mhm.
happen, maybe not right when they're diagnosed, but just to start explaining terms. Just to say,
Yes.
you're going to hear words like palliative care. Palliative care is not end of life care. And
Mhm.
you just give them a few different um, pieces of information at a time, not overwhelming the patient, and say, did you understand what I told you? Why don't you repeat it back to me and let me know where you still have concerns? Because we can tend to give too much information sometimes as well, too. But
Yes.
that is such an important, we can help patients with palliative care through the entire continuum of care into post-treatment survivorship and whatever that looks like too. So we used to hold off those discussions later, but I think it's really important we have those discussions earlier in the patient's journey.
Absolutely. Thank you for that. You've actually explained a lot of stuff because when I'm in certain meetings like this and people are like asking, okay, Grace, you have been through that cancer trajectory. What do you think and all that? And I say, I'm no expert, but I do know that there's end of life care and there's palliative care and there are differences. And so them listening to you now as the expert, they'll be able to be rest assured that not every palliative care advice, tends to be negative or mean that, okay, you give up, there's nothing else to do.
Yeah.
So yeah.
And they can
Anyway.
always ask for a palliative care referral too, right,
Hmm.
Grace? They
Hmm.
can just say, I'd like to learn more about it. There's nothing
Hmm.
wrong with any question a patient would ever have, just because it's really
Yes,
important. They deserve to know.
exactly. There's still a lot of people that are quite, should I say, reserved. They don't want to rock the boat.
Yeah.
Many of them I've spoken to say, listen, when we get into our doctor's offices, what we said we would ask him, we tend to, not to ask him. And then
Sure.
when we get back into the car, we're regretting. And I'm like, if you feel uncomfortable asking your doctor about something, then you should change doctors
There
because
you
I have
go.
to be able to walk into my doctor's office with a lot of confidence and know that he's going to answer my questions. So
Absolutely. Absolutely.
yeah. So, you were talking about caregivers, going into those discussions with, their wards and loved ones. Now they are unseen at the end of the day. What advice would you give to those caregivers who are invisible themselves in all that is
Yeah.
happening?
Yeah, they have a very unique role, right? They have a 24 hours a day, 7 days a week role. They have their own concerns, they
Hmm.
have their own worries. They want to help their loved one as much as possible, and sometimes don't know how to do that. They're sometimes out there looking up information on their own, which may not be the best information either, right?
Hmm.
So we have to be there for them. In fact, with my program, I always said patient and the caregiver, that's one team,
Hmm.
right? They have to stay together. We have to treat them because, cancer is not just for the patient, it's for the family, the caregivers, co-work. I mean, it's quite a large group. So
Hmm.
so to make sure we are actually meeting the caregivers' needs is really important. In fact, I'm doing a really neat study with a group of doctors up in New York. I want to actually ask the caregivers what is their distress? What are their concerns? It's all about the caregiver. So we want to do it's called a IRB study,
Hmm.
an institutional review board study. So we want to publish and present this as well too, because we know caregivers' needs are very specific, but what are they, right? Let's talk about it so we can address it and provide more resources.
Absolutely. That's so great. Yeah. And you have also managed teams, like you said, across the continuum, from diagnosis to, healing and recovery and all that. A question I'd like to ask you is if you could redesign these departments, that all those departments that are integral to that patient, how would you do so?
Yeah, yeah. And so this is one of the key questions I ask when I'm working with a program. I'll say, okay, how are you sharing information about the patients? And we're like, oh, well, we'll call each other. Maybe we'll text each other. And I go, do you ever meet with each other? Do you ever sit down and discuss the patients, what their barriers are, what their concerns, their caregivers' concerns? What educational material you gave them, what are their life goals? What are their treatment goals? Are you talking about that? Are you saying, okay, this patient is going to need, a dietitian, clinical trials, a social worker, financial counseling? You need to actually sit down and talk. It's amazing how many programs still don't do that, right? They're still relying on EMRs, or the electronic medical record is an EMR,
Hmm.
or texting each other, but to have that ability to sit down and talk with each other is important. I think one of the greatest programs I ever saw was actually a tumor conference. This is where a patient is presented to the physicians and all the support services.
Hmm.
One of the doctors said, I want the support services right up front. I want to hear what these barriers are with this patient, this individual patient. What are their concerns? Where are they with their finances or transportation, or what barriers, what are, what's important? Did you get them to the social worker? Did you get them to the dietitian? And that discussion amongst the entire team, it caused a really beautiful synergy. So we were all
Nice.
on the same page for the patient. I always say increase communication amongst the team and decrease communication for the patient. The patient will realize, they're like, whoa, you people are talking to each other. This is
Hmm.
great. I didn't have to retell my story again. And I think that's a big success of a multidisciplinary healthcare team, is that that patient identifies that, wow, this is great. I'm getting really good care because they're listening to me.
Absolutely. You know something? You just reminded me of a seminar I was at, a virtual seminar I was invited to. And one of the speakers was from Estonia. Now, Estonia, they're doing marvelous things when it comes to patient navigation. And like you said, everybody being in sync and conversing. Because they said, listen, we every Friday or every other Friday, we drop our phones, we meet up, and we talk about these people that we're supposed to take care of and the outcomes were out there for everyone to see, and which at the end of the day, augurs well for the patients themselves. So
Yeah,
it's
I
really
agree.
cool. Yeah, it's really cool. So, which brings me to a very important question, as I know that you're the co-founder of Turnkey Oncology, doing marvelous work for patient navigation, the systems, and for patients like us who need assistance. Please, could you tell us a bit more about Turnkey Oncology? Excuse me,
Yeah,
my voice is, tearing up, but please pardon me.
I think you sound lovely. So
Thank you.
turnkey oncology, we actually, these are two colleagues that I've known for decades, and I just respect them tremendously. Meg has a background in a lot of just patient or individual distress, right? And
Mhm.
how can we relieve that through mind, body, spirit, right?
Mhm.
And she's actually won an international award for a program she created called Cancer Round.
Oh,
Beautiful program.
wow.
A lot of all evidence-based because she's a nurse by
Mhm.
background,
Mhm.
around meditation, visualization, frequently asked questions. What should you ask your clinical trial stuff? What should you ask your medical oncologist? What should you ask your surgeon? A lot of resources. So now she's also going into a program called Finding Peace. Again, we're all in our journey, right?
Yes.
Help find peace for ourselves. Um, my other colleague, Lisa Marshall, her in background is in rehabilitation. And so both of these great entrepreneurs um, have gone out on their own. We actually worked for programs or large health facilities, and we all went out on our own. Lisa actually does lot of work around educating the clinicians around cancer,
Mm. Mm.
around rehabilitation service, around prehabilitation. So let me explain that concept because that means you're starting to get exercises and do exercises even before you have, for example, your surgery.
Surgery. Yeah.
When is the worst time to be treating a patient about their exercises? When they're in pain, right?
Hmm.
Let's teach them those exercises before they even have that surgery. Crazy, right? Novel concept. And you can see the outcomes are better.
Yes.
The period of recuperation and rehabilitation actually gets smaller and the patient has better outcomes. My background is 100% clinical. I've worked with clinical trials, survivorship, navigation programs, multidisciplinary centers, bone marrow transplant, discharge planners, did some home care, did a lot of operational assessments around medical oncology, radiation oncology, just a lot of workflows. So between the three of us, we kind of had a neat synergy and we created what we call turnkey oncology. And we've actually all been able to help programs across the country um, to enhance their programs and whatever that might be. So we meet every couple of weeks just to touch base, say, how are you? New
Hmm.
referrals. I'm working up with a program in Iowa called Blueprint Nav. It is actually a platform for navigators so they can work more efficiently. So it's navigator, but then there's also a platform for the patient and a platform for the caregiver so that the navigator can very effectively send information, evidence-based information and resources to the patient and caregiver via a platform, because cancer
That's
is not a nine to
wonderful.
five job. Oh, we're thrilled. So what we're going to do is incorporate cancer around those mind, body, spirit, you
Hmm.
know, very important resources into this platform as well, too. Guess what? We're not going to do it just for the patient and caregiver. We're also going to give it to the navigators, right? They have different
Yeah.
stressors too.
Hmm.
So we look for opportunities how we can complement each other. Um, and just work together, just really because we love what we do in oncology and
Yeah.
just how we can enhance programs across the
Hmm.
country.
Hmm. Oh, it shows you love what you do. I mean, it's written all over you. Yeah. And you were talking about your one of your co-founders, re as you know, her specialty is rehab, and her advising or showing those patients, prior to surgery. And I couldn't agree more because when I had breast surgery, I started doing those exercises after,
Yeah.
and my chest muscles got very tight.
You're sure, sure.
Yes, it was horrendous, I must tell you. So I started on my own and, stretching and all that. Took some time for me to really open up those muscles, and feel much, much better. So what
Right.
she's doing, I can really understand. Many people don't know that these exercises should begin before. That's
Absolutely.
wonderful. What is one conversation that you think that, oncologists should have with their patients, that will kind of shift, their thoughts of living beyond cancer?
Yeah, so we kind of touched on a little bit. Survivorship is really starts at the time of diagnosis, right? So let's, as healthcare providers, let's give the patients they need when they need it, right?
Yes.
Let's not wait to their post-treatment, then let them know about late and long-term effects, right? Or, how to deal with their neuropathy. Don't wait till when they're done their treatment. Let's start having these conversations as they go through because we know what different treatment modalities are going to cause for our patients,
Hmm.
right? Let's have the conversations early. Let's have it several times as well because we know it takes us a few times to remember some of this information. Let's also give our patients information about it that they can take home and read it.
Yeah.
And then our navigator can actually even follow up and say, did you understand what the patient gave you? I think what's important too, and we hear from our patients all the time, they gave me so much information, I didn't even know what to look at. I was giving so much information. I threw it out. I've actually had patients say, you know what? I threw it in the trash. So we need to be thoughtful about what we give the patient, when we give the patient, and is it meeting that need right there? So it's really engaging the patient about, what's concerned. Tell me about what you're feeling right now. What's your
Hmm.
body telling you?
Hmm.
Oh, you're feeling that tingling. Oh, let's talk about that. The term is neuropathy. Or, oh, you're having sores in your mouth, or you're not sleeping well, or you're feeling burning in your chat. Let's talk about that and
Hmm.
give them the information when they need it, but then reinforce it. Have the entire team kind of reinforce it. Grace, it comes right back to that initial conversation that we had, like, listen to me, like,
Yeah.
just listen to me.
Hmm.
And if we listen to our patients, we're going to provide the absolute best care in the world, right? We could be the
Yes.
best doctor and the smartest doctor in the world, but guess what? If we're not listening to our patients, we're kind of missing it. So I think that's what I would say to healthcare providers is, you know what? Listen to your patients. They know their body
Absolutely.
better than anybody else.
And what would you say to the patient?
Wow. Don't be afraid to speak up, right? You brought that up. You're right. They get in there and like, oh, I know elder patients that would say, wow, if the doctor told me I had to cut off my head, I'd say, when's it being scheduled, right? Whatever the doctor said was
Exactly.
right. No, 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 no. So go in prepared, right?
Hmm.
If you're going to be having that chemotherapy or immunotherapy talk, look for some resources at the evidence base, like go to your American Cancer Society, NCCN, National Cancer Institute. Don't just look up anything. Go to those evidence-based resources, and you can Google evidence-based resources.
Hmm.
You can actually Google what are some frequently asked questions I should ask my medical oncologist about chemotherapy. Go in
Hmm.
prepared. Don't be scared. Don't be
Yes.
scared, and take somebody that's going to listen with you, and maybe take some notes for you. And it's okay to say, I didn't understand what you said. This
Yeah.
is a lot of new information. And it's also okay to, when they get home, like, oh, I really didn't understand what he said. And I was a little nervous, but you know what? I'm going to call either the office nurse or I'm going to call my navigator, or I know my navigator is going to call me anyway, and I can have this discussion with them too. So,
Hmm.
you know what? You have to be your own advocate. And I know you were your own advocate, and
Hmm.
bravo to you because it's really important. But there's nothing wrong with that. And it's actually very important that you get the best care you deserve too. So be your best advocate.
Great. That's wonderful advice. Thank you so much. They definitely will be listening to that. So, before I allow you to go, what is one fun thing about you? How do you, with all that's going on, how do you, relax?
Well, I love life. I love my job. As you notice, I would not
Yes.
be in oncology if I didn't love what I do. I'm very passionate. I do a lot of work around, navigation survivorship. What do I do? I have probably some of the best friends anybody could ever ask for. Some of them since kindergarten, which is crazy, right?
Nice.
With
Yes,
friends
me
since
too.
kindergarten. I think that's important. Those relationships that,
Hmm.
they're there, good, bad, ugly. They're always there
Hmm.
for you. I
Hmm.
have a very supportive family. I have a daughter up in New York. We love to go see the plays.
Hmm.
We love the theater. My friends and I love the theater. I'm in
Nice.
Delaware, so we have our Delaware beaches. So
Oh,
that's
lucky
also
you.
wonderful.
Hmm.
And I make sure, I exercise and take the best care of myself too, right? Mind, body, spirit. And, prayer is good. Every day's a good day.
Absolutely.
You got to just
Absolutely.
really, you got an attitude of gratitude is just really important.
Awesome. Well, now we've come to the end of our show, but not the end of our friendship. Thank
Never.
you so much for coming on and supporting this show and giving your all, information, love, expertise, and those wisdom nuggets that people like us who get that, diagnosis are like, oh my God, so overwhelmed. Thank you for putting us straight. And I know anybody watching now would be the better for it. So thank you for coming on, Tricia. God bless you.
Oh,
And I'll let you know when this
Grace,
is
thank you
done.
so much for inviting me.
Thank you.
Yes. Thank you so much.
You're
Absolutely.
welcome. God bless you. Talk soon.
You too. All right.
Bye.
Bye-bye.
Bye-bye.